And the Health Secretary has said he wants to ensure no parent or baby is ever let down again. Well, let's go to Westminster now and our political correspondent Kit Bradshaw. Kit, the investigation will also focus on 9 babies that died at University Hospital Sussex.
That's right, Sangeeta, because that NHS trust has been identified as one of 10 across England of greatest concern when it comes to the standard of maternity care. So they'll be the first focus for this rapid review ordered by the Health Secretary, Wes Streeting, at a health conference in London this morning, in which he said the standard of maternity care that he called a crisis is the biggest potential patient safety challenge facing the health service.
This will be an evidence-based investigation setting out what's going wrong and priorities for action. It will look in detail at up to 10 maternity units that are giving us greatest cause for concern. And I'll be ordering an investigation into 9 specific cases identified by families in Sussex who are owed a thorough account of what happened in those cases.
Well, one of those 9 families that Wes Streeting mentioned there from Sussex is Katie Fowler and Robert Miller from Hove. Now, in 2022, Katie went into cardiac arrest while travelling in a taxi to the Royal Sussex County Hospital in Brighton, despite being repeatedly told by staff to stay at home, despite her situation worsening. She ended up giving birth via emergency C-section in the hospital reception. Her daughter Abigail died 2 days later.
We've had a battle to get answers about what went wrong with our care. We had an external review which found that we should have been invited into the hospital sooner, and that may have made a difference to the outcome for Abigail. That obviously left us with more questions. What could have the outcome have been? What could have been different? What should have happened? We didn't ever get answers to those questions from the trust.
At some points it's felt like gaslighting, and other times it's felt like they've tried to isolate us and make us feel like it was our fault. It's only when we met other families in the local area that we realised the extent of the issues.
So, Kit, what has the Sussex NHS Trust had to say today?
Well, University Hospital Sussex, which is the trust at the focus of this rapid review, and they run maternity units in Worthing, in Chichester, in Brighton and in Haywards Heath. They told us in a statement this evening that there is no more important priority for them than the safety of everyone using their services, and they will fully support this investigation to help improve maternity care both in their units and across the NHS. Now, this has been described as a rapid review. As we were hearing in Mike's report, this is not a public inquiry. Ministers are clearly keen that this is not kicked into the long grass, and that those leading the review identify improvements that can be made so they can be made quickly.
Kit in Westminster, thank you.